Hi everyone, this is Julia Kahudiak for Randy's Assisted Living Manor, and today we'll be discussing safe driving. And so the blog will be talking about should your elderly person be driving or not. This is probably a sour point for a lot of the elderly because they feel if they can't drive, a lot of their independence will be taken away. But I do feel it is the responsibility of family or loved ones to make sure that they are driving in a safe manner before someone gets hurt. So there's a few things we need to look at. So in terms of identifying any particular signs that they may require alterations in their driving schedule or habits, or stop driving altogether. So why should the elderly person stop driving? Well, that's a very good question. I think it has to do with safety and possibly not getting involved in a very devastating accident. And what I mean is that there's a loss of life. A lot of times this can happen in a young person as well, as we all know this, but we're talking about usually health issues that are affecting the elderly person, and sometimes day to day, hour by hour, their condition changes. So when they're driving, this might affect how they concentrate and how they focus on their driving, which may affect them severely. So one of the things, it's important that statistics have found that the family members are the ones that actually have been the ones making reports to the DMV, even before law enforcement. So it is important that you, as a caregiver, have certainly make some effort into watching how your family member, parent drive. So ride along with them as a passenger and be willing to address the issue that you feel poses a real potential risk when they are driving. And something to discuss with them, obviously, once you finish the ride. And anyway, so what can affect some of this? So one of the things, as I mentioned earlier, are health issues, which can differ vastly from day to day, hour by hour. And some other warning signs could be that they're crashing and there's frequent close calls. You're finding dents or scrapes on the car. You're finding that their fence post or mailbox or garage door has dents, or their fence is down. You're finding, or someone is telling you that they're getting lost in traffic, or you're getting a call from their cell phone saying, "Where am I?" That they're having trouble following traffic signals and road signs and or pavement markings. That they're responding slowly to any kind of unexpected situation. They're confusing the gas pedal with the brake pedal, which is a very difficult thing because one thing, as you well know, what one pedal does versus what the other pedal does. But if you're confused and you don't know which pedal is doing what, can you imagine what kind of ruckus this might be confusing in traffic? You might be seeing that this person is experiencing road rage and having either poor concentration and focus on what they're doing. You might see in the mail that they're getting a lot of traffic tickets and speeding. So, the responsibility really is for you to decide what needs to be done next. So one of the things you may want to look at also is that they really shouldn't be driving in very bad weather. They should maybe just be driving during the daytime, maybe have their reflexes checked by the doctor. And also, can certain medications be affecting their driving? And that certainly could be the case. Also, I find very important is that they should not be drinking and driving, or just having finished several glasses of wine or whatever it is they're drinking and then decide to drive. That is not a very good thing. So we've just talked about few things, but there are certainly driving courses out there or driving institutions that look at the elderly in these lights, and they do courses, and so maybe you should speak to these. driving instructors. And I hope that I have covered some of the more important issues that happen to the elderly during these driving risk issues. If you have any questions, just give us a call at 315-200-0658. And thanks again for listening.